surgery. You don't need to know all that. But what I will tell you is that now I'm having troubles. They always say you have to have revision surgeries. Like once they, are dealing with the cancer stuff, they're like, you're probably gonna, they do the bare minimum and what they can. And then, they try to do other things and, improve upon it or do whatever. Or if there's an issue. And apparently the one that I didn't even have cancer in, that's the one that's gone wonky. And so it keeps flipping. I didn't know that was a thing, but it flips. And then it looks like I have a saucer boob because it's flat on the bottom and round on the back. So it looks like a saucer. And they're telling me how to flip it. And then the internet was telling me, and you gotta like lean over and try to do it. And I couldn't do it. I called. The lady says, sometimes you need a man's hands. And I go, a man's hands? Did you look at my file and see that I was married? Because if not, you expect me to just find a man and say, hey, excuse me, sir, could I use your hands to help me flip my implant over? I just need your assist for a minute, if you don't mind. I think she meant, so first I'm like, maybe she meant manhandle. No, she meant man's hands. You just need big hands, which are usually a man's hands. But you need bigger hands to be able to fully grab the implant and flip it. But even then, we weren't sure we did it. But I am like leaning over and my husband's doing this number and I felt like I was being milked. It was very cow-like. I was practically on all fours. He's doing this thing. Then I go into the office and the doctor's doing it, but he has me lean back and he's trying to flip it. And I said, you get it? He goes, well, I don't know. And I'm like, well, if you don't know, I sure don't know. So anyway, he said the pocket's too big. I guess it was tight initially. It was the size initially that he could fit in that pocket, but I guess the way it heals, you can heal differently. So he either has to make the pocket smaller or put in a bigger implant. I don't know, but I have to have another surgery. I don't know when. We're waiting on my radiation decision, which I will discuss here shortly. But that's the surgery talk. For anybody who has any questions, I am smaller, but it's still large. He just put in what he could fit after the breast surgeon was done, and after, you have to like look at how much viable skin and that's getting blood flow, et cetera, et cetera. I think they removed, like, your boobs aren't even, right? And obviously when weighed, mine were definitely not even. You could tell because now I have the weight. I think the largest one was like 933 cc's/grams. And the implants they put in were 650. So a significant size difference. I don't love it. And not because I don't think these are big enough, but because I don't look like me. And that was the main thing I wanted. I was like, I don't recognize myself in the mirror at all. I wanted to still look like me to some extent. You know what I mean? I can't, my clothes don't look right on me. The things, it looks different. On the upside of things, I don't have to wear a bra. I mean, I have to because this one keeps flipping and you have to for a long time for compression. But I can actually go without wearing a bra and things are still up. Up, guys, up. They're up. They're, they're right there. They're stapled on your chest, which by the way, they're not stapled, they're stitched. There's like a mesh bag or a mesh, I don't know exactly what it looks like, but I know there's some kind of mesh thing that is stapled to your chest muscle, and that's what the implant's in. And I know this because you're not supposed to like lift or I forget the rules now, it's been so long, but like push or pull or do whatever more than 10 pounds, which isn't much, but you can feel it, everything hurts, right? You're like, so but I was just doing the dishes and I was, how you try to get something crusty off a plate? So I went to push to get some crust off a plate and I was like, I mean, some excruciating pain. It went down my arm. Would have thought I was having a heart attack if I didn't know I just had some breast surgery. And so I'm holding my boob. I call my husband and I was like, I think I broke my boob. And he's like, you broke your boob? How'd you break your boob? I was like, I don't know, but I broke it. Couldn't even open the Motrin container because, by the way, this all involves chest muscles. Just saying. So, childproofing stuff, it's super obnoxious. So, I just didn't move until I got home, and then I asked him to open up the Motrin and leave it open. And, yeah. So when I called the office, because I was like, what happened to me? she said, oh, you probably popped a stitch. And then I caused a muscle spasm because the muscle doesn't like that it was, had a stitch and it was pulled and all this other stuff. And I was like, well, I don't blame it. I don't blame it at all. So fortunately that went away, but that really hurt. Every time I moved my muscle, it was very, very tender. So, but yeah, the drains were horrible. So now I've got big drain scars on the breast. It was hard for me to see my husband see them. For those of you who are going through this or who are asking, it's definitely different to see yourself. What I imagine a lot of people have gone through with different surgeries that have changed their appearance. I've been looking at these for since 8th grade. I've had big boobs, so, and boobs in general, breasts. And so I didn't want to look at it. I didn't look at it for a minute. My husband saw it in the office when they pulled it off, and I cried, but it was more because, he was wonderful. He goes, oh no, it looks good. I think it's gonna look good, and it looks fine, blah blah. And but I'm just sad because I feel, in that moment I felt a little marred, maybe beat up, not presenting my best. You want to look your best for your spouse. Have something good to offer them. And honestly, when I finally did see it, it looked like my breasts were in a fight, and my nipples were the casualty. That's how I've explained it. That's what it looks like. It looks like I lost, for sure. But I lost my nipples in it too. So I've actually already gotten used to the no nipple thing, and it's only been a couple months, but I'm actually used to it. Like, it's not really a thing. People were right. I don't really notice it. The tattoos could still be in my future, but you have to wait a while, and you have to wait for any revision surgeries and make sure, because you don't want to revise and then this tattooed nipple is in the wrong spot, whatever you do. So you gotta wait. But I wouldn't say that I feel beautiful. There are times where I feel strong because I am going through cancer, and there are times, like, not because I feel strong because my body has survived the chemo and this poison and what was done to me. It's gotten rid of cancer. It's surviving all these things being thrown at it, a major surgery and things being cut off and carved up. It hurt so much in my armpit where they went and got the lymph nodes because they went through the mastectomy. I could have sworn they made an incision. It hurts so bad under my arm. It's still very numb and tingly. Like, if I put deodorant on, I can't really feel parts of it because I'm sure they destroyed some nerves that are there. But so sometimes I feel strong and beautiful because of what my body has done and gone through. And I know full well that this is what God has brought me through, and I know that. But the human body is amazing, right? The way God created it, and what it can do, and what I have prayed through, what I have been through, what I've waited through. Because there were days during chemo when it was the worst. I think I told you, I think at the worst, it was just, I just gotta make it to tomorrow. I just have to, I've, they do those stupid scales, 1 to 10. I was an 11, and I was just miserable everywhere, every inch of my body. Everything hurt. Everything was awful. And I felt like I was being killed. I was being poisoned, which, apropos. But I knew that the next day my cells, some would be coming back, some, some would have been coming back or renewing or whatever, and I might feel differently. And so I remember sometimes just going, okay, maybe if I could just sleep, when I wake up, it'll feel different. It'll be tomorrow. And I just waited for the next day. So the fact that I got through all of that, and I'm on the downside of things, I would say, like down trajectory, like towards the end, end in a good way, not in a dying way. Um, you know, I can appreciate that about myself, so I can feel strong and beautiful in that way. But other times, you know, I'm human and I'm like, I don't have my eyelashes back. I have a tiny bit of mascara on, the few that I do have, because I decided I haven't been wearing mascara. I haven't been wearing falsies because, you know, I read somewhere like, you know, I think the falsies were pulling off what the new lash growth. You know, you get glued too close and you can risk that. The mascara, you have to like, you know, rub off and remove, and you can remove the eyelashes. So a lot of people are advising just let them be, let them grow, just be without for a minute and let them grow. So I put on a little bit to see and to go out today, and of course they're very short, very tiny. I don't have a ton yet, but it's hard because you go from a woman that, you know, you like, you know, you have long lashes and you do your eyes and you have your hair that we worry about and make look pretty, and you know, our breasts, no matter what size, make us feel feminine, you know. And so all of that very swiftly gets taken away. And even like my toenails, they're not back yet. I'm missing a lot of toenails, and they're half on, the ones that are still on. They're janky looking. My nails, however, are coming back. My skin is dry and flaky. It's so bad. But my skin was destroyed, right? The cells were destroyed. The skin was, you know, so, plus it's winter. But it's all gonna take a minute to come back. But you don't feel like you, so you don't feel, you want to be your best version of yourself. That's what you want to present to the world. That's what you want to present to your loved ones. And I don't get to do that, but I know I'm presenting the best I can at this point in my life. And this is just, as my husband say, is a human condition, and it's an interim, and it's, you know, I'm gonna make the best of it, you know. But as a girly girl, I'm like, everything that is considered very girly girl, very feminine, the hair, the lashes, the whatever, is, you know, absent right now. So, so that's hard every now and then. Like, you know, Valentine's or whatever, I'm trying to look pretty, and you know, I wore a wig and I put my dress on, even with my wonky boob, and you know, it's just, life isn't what you thought it would be, but a lot of times life isn't, and that's okay. And at the end of the day, it just matters that you know, you love others, and you surround yourself with, you know, people who love you and make you feel good as well. But what's important is that you be yourself. You know, at the end of the day, none of that stuff matters. You know, it doesn't really. It doesn't. But I do know that it's hard for women out there. I know that it's hard. So I understand for those of you watching that are dealing with it. It's very difficult.